Welcome to the Leo Wellness Podcast. I'm Eric.
And then I'm Zay.
Today we're diving into the fascinating world of bee venom therapy.
You might be thinking, wait, isn't that supposed to hurt?
That's right. Bee stings are known for their pain.
But what if I told you that the venom that causes that pain...
Might also hold the key to... Wow, that's incredible. It's amazing to think that something used so long ago is still being explored for its potential today.
It speaks to the enduring power of nature.
And the potential of natural remedies.
Before we go any further,
Let's clarify something for our listeners.
we're talking specifically about bee venom here.
Not honey or other bee products.
Right. It's important to make that distinction.
Bee venom is the substance bees inject when they sting.
It's different from honey,
Pollen,
propolis, and royal jelly.
which all have their own unique properties and uses.
It sounds like there's a whole world of bee-related therapies out there.
There is.
It's actually got a name, apitherapy.
Apitherapy encompasses the use of all sorts of bee products for therapeutic purposes.
So bee venom therapy is just one branch of apitherapy.
Precisely. It's the most common form in the USA.
But other cultures have different focuses.
For instance, in Japan,
China and Korea.
royal jelly is highly valued alongside bee venom.
So how people view and use bee products varies around the world.
Absolutely. In Eastern Europe, using all beehive products, honey, pollen, propolis, the whole works.
It's pretty common in traditional medicine.
It's fascinating how these practices have developed differently across cultures over thousands of years.
It is. It highlights the importance of understanding different perspectives and approaches.
Health and wellness.
It makes you wonder if we're just scratching the surface of what we can learn from nature.
Absolutely. There's so much we still don't know.
Well, let's dive a little deeper into bee venom itself.
What exactly is in this stuff that makes it so potentially powerful?
Bee venom is a complex cocktail of bioactive compounds.
It's a mixture of proteins
Peptides.
and other compounds. That sounds like a lot going on in one little sting.
It is. And each of those components plays a role in the venom's overall effects.
So let's break that down a bit.
What are some of the key players in this bee venom cocktail?
The major components are proteins and peptides.
Making up the bulk of its dry weight.
And these are the real heavy hitters when it comes to therapeutic potential.
Exactly. They're responsible for most of the venom's therapeutic, and importantly, its toxic properties.
Okay, good to know. We need to be careful with this stuff.
Definitely. But let's focus on the positive for now.
One of the most abundant peptides in bee venom is called melittin.
Melittin. That sounds familiar.
It might. Melittin makes up about 40–60% of bee venom.
And it's been studied quite a bit for its potential benefits.
So what's so special about melittin?
Well, for starters,
It has strong anti-inflammatory properties.
it works by inhibiting inflammatory pathways like NF-κB.
NF-κB is like the master switch for inflammation in your body, so by blocking it.
Melittin can put the brakes on your body's inflammatory response.
So it could potentially help with conditions like arthritis or other inflammatory diseases
That's right. There's evidence suggesting that melittin can help reduce pain and swelling.
associated with inflammation.
That's pretty impressive. Anything else melittin can do?
It doesn't stop there.
Melittin also has antimicrobial activity against bacteria, fungi, and even viruses.
It's like a tiny warrior fighting off all sorts of invaders.
Amazing. So it's anti-inflammatory
Antimicrobial.
and antiviral. This melittin sounds like a superhero.
It's definitely a powerful little peptide.
But it's important to remember that the effects of melittin are dose-dependent.
Small doses can be beneficial
But high doses can be toxic.
because it can start to destroy cell membranes.
Okay, so it's all about finding the right balance.
Exactly. That's why it's crucial to work with qualified healthcare professionals if you're considering bee venom therapy.
They can help determine the appropriate dosage and ensure your safety.
Good point. So we've got melittin as a star player.
Any other notable peptides in bee venom?
Definitely.
There are a few others worth mentioning. Albumin, for example.
Is a neurotoxic peptide that's been studied for its potential in treating neurological disorders.
In controlled therapeutic settings, it has shown potential for enhancing neurotransmitter release.
And promoting nerve repair.
Neurotoxic. That sounds a little scary.
It can be in high doses.
But in controlled therapeutic settings, albumin has shown potential for enhancing neurotransmitter release.
And even promoting nerve repair and regeneration.
So it could potentially help with conditions like Parkinson's disease?
Or multiple sclerosis.
That's the idea. Research is ongoing, but there's some promising evidence in those areas.
Interesting. Are there any other peptides we should know about?
Another key one is adolapin
It's a peptide with both anti-inflammatory
and pain-relieving properties.
Adolapin works by inhibiting COX enzymes, which are involved in the inflammatory process that leads to pain.
Think of it as cutting off the pain signal at its
Oh,
source.
so a double whammy against pain and inflammation,
Precisely. Adolapin works by inhibiting COX enzymes.
which are involved in the inflammatory process that leads to pain. It's like cutting off the pain signal at its source.
That's pretty amazing. Any last peptides we should cover before we move on?
One more worth noting is MCDP.
Or mast cell degranulating peptide. It stimulates the release of histamine and other immune factors from mast cells.
Basically kicking the immune system into gear.
So it could potentially help with immune-related conditions.
It's possible.
MCDP can enhance the body's defense mechanisms, but it can also trigger allergic reactions in sensitive individuals.
Again, careful dosage is key.
Okay, so we've covered some of the star peptides in bee venom.
What about those enzymes you mentioned earlier? What role do they play?
Enzymes in bee venom help spread the venom throughout the tissues.
And contribute to its overall biological effects.
One of the most abundant enzymes is phospholipase A2,
It breaks down phospholipids in cell membranes.
making tissues more permeable and allowing other components of the venom to penetrate more effectively.
So they're like the delivery system for all those powerful peptides.
You could say that.
But it's also a key allergen for some people. So it's important to be aware of potential sensitivities.
That makes sense.
Yeah.
Are there any other enzymes we should know about?
Yes, there's hyaluronidase,
Which is sometimes called a spreading factor. It breaks down hyaluronic acid.
a key component of connective tissue, which makes it easier for the venom to spread.
Hyaluronidase can also potentially enhance wound healing in small doses.
Interesting. So it's kind of like paving the way for the venom's action.
That's a great way to put it.
Wow. So there are potential benefits even beyond addressing pain and inflammation.
Absolutely. Bee venom is a complex substance with a wide range of effects on the body.
Okay, so we've covered some of the major proteins, peptides, and enzymes in bee venom.
What about those other components you mentioned, like minerals and trace elements?
What do they do?
They play supporting roles in the venom's overall activity. For example,
Bee venom contains histamine.
which contributes to the inflammatory and allergic reactions associated with bee stings.
However, at therapeutic levels, histamine can actually enhance blood flow and tissue repair.
So it's like a double-edged sword depending on the dose.
Exactly. Bee venom also contains catecholamines, like dopamine and norepinephrine.
Which are neurotransmitters that influence things like heart rate
Blood pressure.
and
Wow.
pain perception.
Yeah.
And then there are amino acids and minerals like magnesium and calcium.
All contributing to the venom's overall bioactivity. It's really quite remarkable how all these different components work together.
It sounds like bee venom is this incredibly intricate and powerful substance with a lot of potential, but also some risks we need to be aware of.
You got it. It's definitely not something to be taken lightly.
But the research on its potential benefits is definitely fascinating and worth exploring further.
Well, on that note, let's move on to those potential benefits.
What are some of the key areas where bee venom therapy is showing promise?
One of the most well-studied areas is its anti-inflammatory effects.
Bee venom targets specific molecules and pathways involved in the inflammatory response,
So it's not just masking the symptoms.
but actually addressing the root cause of inflammation.
That's the idea. And because of this,
Bee venom therapy has shown potential for conditions like arthritis,
tendinitis,
bursitis, and even chronic inflammatory diseases.
that's pretty remarkable. Are there any other areas where it's showing promise?
Definitely. Bee venom has also demonstrated antiviral properties
Some of its components can directly target viruses.
and even stimulate the immune system to fight off viral infections.
So it could potentially help with things like the common cold or even more serious viruses.
Research is ongoing, but there have been some interesting findings. For example,
Bee venom has shown some potential for treating shingles.
and herpes simplex virus.
That's incredibly promising. What other potential benefits are there?
Bee venom also has antimicrobial and antifungal properties,
It could disrupt bacterial and fungal cell walls.
even those of some drug-resistant bacteria,
So it could potentially be a valuable tool in fighting infections.
especially with the rise of antibiotic resistance.
That's one of the areas researchers are excited about. It could be a game changer in how we approach infections in the future.
This is all so fascinating. Are there any other potential benefits we should discuss?
Absolutely. Bee venom also has neuroprotective potential.
Meaning it can help protect nerve cells from damage and even promote nerve repair.
So it could potentially be helpful for people with neurological conditions.
Exactly. There's research looking into its potential for conditions like multiple sclerosis
Parkinson's disease.
and peripheral neuropathy, all of which involve nerve damage.
It seems like bee venom could have far-reaching implications for many different areas of health.
It really does. And we're just scratching the surface here. We still haven't even talked about its potential for pain management,
Immune modulation.
skin rejuvenation, and even cancer treatment.
Wow, there's so much to unpack. This is definitely a deep dive worthy of its name.
I agree. There's a lot of exciting research happening in the world of bee venom therapy.
And it's definitely a field to watch.
Well, we've covered a lot of ground in this first part of our deep dive.
We've explored what bee venom therapy is, its long history.
And the complex composition of bee venom itself.
We've also touched on some of the key areas where bee venom is showing promise.
But we've only just begun to explore its potential benefits,
Exactly. We still have a lot more to discuss.
including how bee venom can be used therapeutically.
What the potential risks and side effects are.
And what the future holds for this intriguing field.
So stay tuned for part 2 of our deep dive into bee venom therapy, where we'll delve deeper into those